Hi, I'm Dr. Sulata Shenoy, Psychologist and Director, Turning Point, Centre for Psychological Assessments, Therapies and Counselling, Jayanagar, Bengaluru. Teenage is by and large a turbulent period, a difficult period both for the adolescent as well as the parents. So we see that parents find it difficult to communicate with the child. Children seem to be more leaning towards peer pressure, media pressure, and we've seen this through generations. So this is nothing new. And we also find teenagers going through a lot of mood swings, which is also physiological as well as psychological. So the hormonal imbalances that take place in the body during the teenage years can play havoc with a child's thoughts, feelings and behaviors, and this may be very difficult for parents to understand what is happening to the teenager. Now let us see how teenagers can deal with this, and not only that, let us see how teenagers need to be identified. First of all, we need to acknowledge, we need to identify, we need to understand how to look at children who are at risk for extreme behaviors such as suicide. Now the very mention of suicide, many parents or people don't want to acknowledge or look at. In fact, they feel that even mentioning or talking about it could put ideas in the child's mind. Nothing is further from the truth. We have seen time and again that precious lives, budding lives, young lives who are just on the threshold of young adulthood are lost for the families and for societies just because nobody understood their pain nor gave them the proper treatment or therapy at the right time. So what should we look out for? Please understand that this could be a very serious problem, and many parents would like to brush it off as, oh, it's the usual teenage drama. She just talks about, I want to end my life, I want to run away, I hate you, these kind of things. We think that this is the usual tantrums of a teenager, and we need to just tell the child that, look, grow up, stop saying that, and the child would get over the problem. However, we know that it is not so. So on this special occasion of Suicide Prevention Month, I would like to emphasize what we as parents, teachers, family members and society can do in order to help our teens who could be at suicidal risk. So it is not necessary that a teenager who is at risk for suicide would be exhibiting all the behaviors which would then you would be able to understand that a child may be at risk for suicide. Now, who would be at risk? I would say high risk teenagers would be those who are having extreme and frequent and unpredictable depression, mood swings, difficulty in dealing with their emotions and their behaviors. You can see that they are probably addicted to gaming or some other substances, or spending a lot of time away from families and away from homes, and academic grades are dropping. So these are some of the red flags that we need to recognize. Now once we recognize that, many parents find it awkward. Oh, how can we bring that up with a child? So I would say it's important for us to listen. Okay, listening is one of the most important and powerful tools we have. But what do? We immediately jump into advice. Oh, there's no need to worry about it. Okay, it's okay, things are going to get better. Pat the child on the back and say, or get angry with the child and restrict the child and say, you're not going to go out anymore. And this would leave the child more depressed, more difficult for the child to handle his or her own feelings. So listening is the first most important thing we need to do. You can just sit with a child in a calm environment and say to the child that, look, I've been observing few things about you and this is worrying me. So if anything is there that you would like to share, please come and tell me any point of time. Okay, and keep your word. Supposing the child takes you at your word and comes back and says, look, Mama, I've been having thoughts of ending my life. I've been thinking, what's the use of this life? I've been thinking I'm a burden on all of you. I've been so sad that I can't tell you. I've been crying every night. And instead of saying, really, I don't think that's true, okay, you must snap out of it, come on, it's nothing, it happens to everybody. Please show some empathy. Please show some sympathy. Please be prepared to listen and probe further. Instead of cutting off the child at that time, you say, okay, can you tell me more about it? Tell me your feelings. I'm here to listen for you. Let me know more about what you are going through. Okay, so that will give the child and the parent a sense of connection. That, okay, here is somebody who's ready to listen to me. So it could be a parent, it could be a teacher. So what I'm talking about is not only for parents, it's also for siblings. Sometimes a child, a teenager will confide in a sibling. The sibling could be younger or older but not know what to do, and just tell the child that, look, if mama or papa comes to know, they're going to be very sad or they're going to be very angry. Please, let's keep it here only. I'm sure you'll get better. Okay, so siblings also can play a role. Teachers, okay, sometimes a teacher can see in the class a child is listless, morose, not taking interest, grades are dropping, okay, not having friends, being more and more withdrawn, and that is a time you can bring the child to the table and ask the child in confidence, look, tell me what's happening, okay, I'm here to listen, I'm here for you. So that is the final message that you need to give, I'm here for you, okay, so that a child doesn't feel alone. If you have gone through some of the suicide cases, you'll find that their final communication to the outside world is that I'm alone, okay, no one understands me, I'm going through something and I can't tell you about it, okay, or somebody has done something terrible to me which I have kept and this become a burden for me and I'm just not able to deal with it anymore. So you'll find that none of them went into it suddenly or just took an impulsive step. You'll find that there's a culmination or a series of downward kind of mood swings or attitudes or behaviors which will give you flags all along the way. But the trouble is, we adults are not ready to see those red flags. We are not ready to listen to the child, and we probably, in the interest of saying, okay, this is okay, it's just a, normal teenage phase, or you'll be told by many, well-wishing family members or friends that, oh, look, even our children went through that, it's okay, just ignore it, it's all right. But I would urge you not to ignore it. Okay, there is no harm at all. There is no harm in asking the child what is going on. And also, many times we have found that sometimes it could be a case of bullying. Sometimes it could be a case of difficulty with studies, or something else that's happening with the peers, or somebody is troubling the child, or the child is not able to openly talk about it. And keeping those things inside of oneself, and imagine that the child is still trying to understand about the outside world and people at large, and this something happens, then the child can completely slip into a stage where the child feels that there is no coming out of this and ending the life would be the best thing for me to do. So, having said that, then we need to understand that as adults, people who have seen the world more than the teenager, that we need to help the child, okay, and the child may typically rebuff you, put you off, say that, no, I know you won't understand, but you have to be persistent, you have to be patient, you have to not probably intrude or press or make the child more anxious, but make the child relax. Give the child time and comfort to come to you and tell what's happening, and if it is within your power, please do help the child. It could be a small thing for you, like my goldfish died and I'm feeling very upset, or my dog is sick and I'm terribly worried, okay, and I feel that life is not worth living without my dog. So all these things could go on at the back of a teenager's mind. So one has to be very careful, and I would like to again stress for parents, teachers, siblings, extended family members, get involved with what the child would like, okay, instead of trying to force yourself into the child's life. Draw the child slowly, gently, kindly, lovingly into your own world, so the child feels that there is a safe space around me and there are people I can depend upon. All these things that we need to do when we talk of suicide prevention, because remember, suicide is a one-time event which is totally irreversible. and it leads to a lifetime of regret and repentance for all those who are connected with the teenager. And none of us would like to be in that position. So one thing is that you encourage the child to come closer towards you. It doesn't matter. Could be that the child would like to share something which shocks you, would like to say something which goes against what you think the child should be doing. Accept it that yes, teenage is a period of making mistakes, a period of learning, period of experience, risk taking, adventure. These are all part of teenage years. So accept that, and then if necessary take help from those who are there to help you. This could be somebody the child trusts, a professional help, a psychologist, a psychiatrist, a counselor, a social worker, and don't hesitate to ask them, because they are more experienced, they know what to do. And keep your home and the child's environment as clean. What I'm saying clean in the terms of physical items also, like not having on display, okay, like firearms, knives, lot of alcohol lying around, lot of things which could lead the child to imagine how it would be in that position. And at the same time psychologically, make your homes and schools and your social environments as cheerful, as accepting, as inclusive as possible. And remember that we have a responsibility. We cannot blame the teenager, and we have to look at what is happening behind the scenes in the child's mind and give timely help.